Hi guys, welcome to our abdomen lecture. Today we are going to talk about the peritoneal cavity and the peritoneal membranes. Is it right? So you have to understand that from embryology, understand that we have the parietal peritoneum, we have parietal mesoderm, and the visceral mesoderm, right? So in the abdomen, you're going to have what's called the peritoneal cavity, which is the largest cavity in the body, and this peritoneal cavity is also called the abdominal pelvic cavity. Why? Because it is continuous, or it's continuous to the pelvic cavity, especially in female. So in male, the cavity is actually closed, right? But in female, it is actually open communication to the true pelvis, right, via the uterus. That's why you find that there is a high infection of the in the peritoneal cavity in female than in male. Why? Because in the female it completely communicates with the true pelvis, right? Which is the open the vagina, the uterus, and so forth. You understand now? Good. So the pelvic cavity is gonna be made by the following borders. But before we get into the borders, you have to understand that the pelvic cavity is divided into two. We have what we call a greater sac and a lesser sac. We're gonna look at a more clear diagram. But as for now, you have to understand that the pelvic cavity is made by the parietal peritoneum, which covers the body abdominal wall. So this is your parietal peritoneum, right? And then you're going to have your visceral peritoneum. That's actually going to surround your viscera, your stomach, your liver, your small intestines, your large intestines. Everything is gonna be covered by your viscera. Take note of this: the parietal peritoneum and the visceral peritoneum, they are in communication via what we call mesenteries. Mesenteries. So what is a mesentery? A mesentery is a double layer of peritoneum that facilitates communication between the posterior abdominal wall and the viscera. So it actually suspends the viscera in the peritoneal cavity and also acts as a pathway for neurovascular structures to actually get into the to move from the posterior abdominal wall to your small intestines. You understand? So you have your veins, arteries, lymphatics, vasculature coming from the posterior abdominal wall and supplying your viscera. Good. Right. So the parietal peritoneal, it lines the abdominal wall and is going to be receiving somatic innervation from the abdominal wall nerves. So since it receives somatic, therefore, the parietal peritoneum, it's actually going to be sensitive to pain, touch, cold, laceration, pressure. While the visceral peritoneum is only going to be sensitive to stretch because it receives sympathetic and parasympathetic innervation. You understand? Yeah. So let's take a look at the greater and the lesser sac for a minute. Right, so let's take a look here. This area, that's your greater sac, the one with the P, right? This area in this light bluish color, that's your greater sac, right? And then this area with a deep blue, that's your lesser sac. Take note, the lesser sac can also be called the omental bursa. We spoke of this omental bursa when we were talking about the rotation, that it is created by the 90-degree clockwise rotation of the stomach, right, in our GIT foregut embryology lecture, right? So this is the lesser sac, and this is what we call the greater sac. Take note of this: no organs are found in the peritoneal cavity, right? There are no organs. Organs, it's sort of like a balloon, right? Like you take your fist, right, and then you press your fist into a balloon. That's what happens when these organs, visceral organs, are developing embryologically. They'll be grown with towards pressing into the peritoneal cavity. So you're not going to have organs within the peritoneal cavity, right? Good. So you can actually see that this is your stomach right here, and the area be posterior to your stomach, that is your omental bursa, and this is going to be your greater sac. Take note, there is a communication between the lesser sac and the greater sac that is going to be called the omental foramen, or more specifically, it's going to be called the epiploic foramen of Winslow. The epiploic foramen of Winslow. We're going to talk about it very soon. Let's take a look at mesenteries. Mesenteries. So, embryologically, we have two sets of mesenteries. Mesenteries, this is just a double layer of peritoneum that suspends the abdominal viscera in the peritoneal cavity. So we have a dorsal mesentery and a ventral mesentery. The dorsal mesentery, if you remember, it was extending from the caudal limit of the foregut to the hindgut. And the ventral mesentery, which was later divided by the thickening of the transversus by the septum transversum, it was extending from the lower portion of the foregut to the upper portion of the duodenum. Good. So the dorsal mesentery now is going to be given names according to the visceral organ it suspends, right? So the dorsal mesentery that suspends the stomach is called dorsal mesogastrium. That suspends the transverse colon right here is called the transverse mesocolon. That suspends the small intestines, jejunum, ileum, is going to be called your mesentery proper. Right. So a mesentery is just a double layer of peritoneum that will allow or give a passage for the neurovascular structures from the posterior abdominal wall right to your visceral organs. You understand? Good. So let's take a look at the ventral mesentery. The ventral mesentery is actually divided by the development of the liver. So let me take a look at um, a closer picture. Right, so here you can actually see I'm mainly concerned at this region. Right, so the ventral mesentery is going to be divided, right, by the liver. So you're going to have the liver growing into the ventral mesentery. So you're going to have a part of the ventral mesentery that is between the lower portion of the esophagus, the stomach, and the upper portion of the duodenum, extending towards the liver. This is what we call the lesser omentum. The lesser omentum. So the lesser omentum is a free edge right here that is called the patoduodenal ligament. Right? It is within this ligament where you find the portal triad, which is your portal vein, your hepatic artery, and your bile duct. That will be extending from the first part of the duodenum to the what? To the liver. And then from the liver, you're going to have some part of the ventral mesentery communicating or attaching the liver to the anterior abdominal wall. That is what you call the falciform ligament. Remember, it is the falciform ligament free end that will transport the ligamentum teres hepatis, or the round ligament of the liver, together with the paraumbilical veins. Right. So that's your dorsal, that's your ventral mesentery. Your ventral mesentery. Right. So let us talk about the communication between the greater sac and the lesser sac, which we call the epiploic foramen, or the epiploic foramen of Winslow, or the omental foramen. Let's take a look at it. So right here, this is your epiploic foramen, which is the communication between the lesser sac, which is the omental bursa, and your greater sac. You understand? So the lesser sac plus the greater sac will give you the peritoneal cavity. And this is the peritoneal cavity that is between the parietal peritoneal cavity, parietal peritoneum and visceral peritoneum. You understand now? Good. So the epiploic foramen is very important. So how you can find it, you can actually place your finger at the lower free edge of your lesser uh, lesser omentum. So it can actually accommodate two fingers. That's how um that's that's um that's the volume of this space, right? Of each space. It can actually accommodate two fingers. What is important about this sec is to understand its boundaries. To understand the boundaries. So this foramen is going to have a superior boundary, inferior boundary, anterior boundary, and the posterior boundary. So let me tell you the let me start with the anterior boundary. So the anterior boundary is the one that we see here because we are in the anterior view, right? This anterior boundary is actually made of the hepatoduodenal ligament. What is in the hepatoduodenal ligament? We have our portal triad, like I have said, the portal vein, the hepatic artery, and the bile duct. So you can actually see the reflection of these of the portal vein. So this right here is your hepatoportal, hepatoduodenal ligament, forming your anterior boundary or anterior border. And then we are going to have your posterior border. So behind this hand posteriorly, this finger posteriorly, you're going to have your inferior vena cava and your right cruise of the diaphragm. The right cruise in the diaphragm and the inferior border makes the posterior wall or the posterior border of the epiploic foramen. Right, superiorly you're going to have the caudate lobe of the liver, and then inferiorly you're going to have the first part of the duodenum. So let's go through a summary. Anterior boundary, hepatoduodenal ligament with the portal triad. Posterior border, you're going to have the inferior vena cava together with the right cruise of the diaphragm. The superior border, you're going to have the caudate lobe of the liver. And the inferior border, you're going to have the first part of the duodenum. You understand? So those are the boundaries of the epiploic foramen. Let's take a look at what we call the greater omentum. Right, so you're going to have what called the greater omentum and the lesser omentum. We have already spoken about the lesser omentum, right? So now we are now talking about the greater omentum. Embryologically, if you remember, due to the rotation of the stomach, you're going to have the dorsal mesogastrium reflecting anteriorly as an apron. So this is the apron, which is the greater omentum. The greater omentum is a layer of peritoneum, a full layer of peritoneum, right? And it's going to have an anterior border and a posterior border, right? And you have to understand that you're going to have this is your anterior border, and then it reflects downward and curves and becomes the posterior border, right? And it is the posterior border that will continue as the transverse mesocolon attaching to the posterior abdominal wall, right? And within this greater omentum, you actually have what called the inferior recess of the omental bursa. So the omental bursa will actually extend into the greater omentum like this. You understand? The greater omentum is very important because it actually protects the small intestines and the colon, right, from um, external force, and it also acts as the policeman. Why? Because it is the greater omentum that will actually prevent the spread of infection in the peritoneum. For example, if there is what say appendicitis, right, which is the inflammation of your appendix, you actually see the greater omentum will go and completely enclose the appendix to prevent the spread of infection in the peritoneal cavity. So it's very important, very important, right? So that's your greater omentum. So it extends from the greater coverage of the stomach, as we're going to talk of the stomach, right? And then it reflects downward. And as for the lesser omentum, it extends from the lesser coverage of the stomach going towards the liver. Good. Right, so let's us go through a summary, right? So this is your greater sac in green. This is your lesser sac in blue, right? So the lesser sac is can also be uh it also has borders, a posterior border and anterior border. So your anterior border, you're going to have your liver, your stomach, and then the anterior double layer of the greater omentum, and then your posterior border, you're going to have your posterior layer of your greater omentum, and your transverse colon, your mesocolon, right? And then you have this space, is it? And then we said between the greater sac and the lesser sac, you have a communication which is called an omental foramen, right, or an epiploic foramen, which communicates the greater and the lesser sac. Remember, good. We also have the mesenteries, right? You can actually see right here. This is your mesenteric proper of the small intestines. You can actually see right, and we say the mesentery is a double layer of peritoneum that facilitates passage of the neurovascular structure from the posterior abdominal wall to your viscera. Right, so that's everything that I have for you today. Um, oh, I also left something. Let me talk about the um, the paracolic gutter, the paracolic gutters. Right. So this is your transverse mesocolon. Above the transverse mesocolon is going to be called your supracolic region, and below you're going to have your infracolic region. So you have what you call paracolic gutters that are lateral to your descending and your ascending colon that will facilitate communication between your your infracolic space and your supracolic space. Let me look for another for a diagram before I close. Right, so you can actually see these arrows, right? So this is going to be your right paracolic gutter, so just a space, right, that will communicate the infracolic compartment and the supracolic compartment and the infracolic compartment. So you have your right and left colic gutters, paracolic gutters, right, which are very important, so that you can actually have infection or pus or a brace that is coming from your busted um, appendix, right? You can actually see this pus going to race in your subphrenic recess, right? Going into subphrenic what? Recess. You can actually see we also have what called a subhepatic space, right? And a subphrenic recess, and yeah, so you can have your pus or your abrace from your appendix moving via these paracolic gutters going to rest in your phrenic recess. So thank you so much, guys. Take care.